Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. Two new coronavirus cases bring total in New Hampshire to 4. 150 people being monitored. 3 of the 4 cases are related. New Hampshire health officials gave an update Sunday on 2 new presumptive positive cases of the coronavirus in the state, saying that an additional 150 people are under public health monitoring for the virus. The 2 new cases, one in Grafton County and one in Rockingham County, are in addition to 2 confirmed cases in Grafton County, bringing the total number of cases in the state to 4. The new Grafton County case was identified in a man who is believed to have contracted the virus through contact he had with a person at a service at the Hope Bible Fellowship Church in West Lebanon on March 1st. The person that the man had contact with later tested positive for COVID-19, becoming the second person in the state to be diagnosed, but was not showing any symptoms at the time of church service. All 3 of the Grafton County cases are related, as the person with the virus who attended the church service and spread it to the newly diagnosed man had initially contracted it through contact with the first person in the state to test positive. That first person was diagnosed with the virus after returning from a trip to Italy. About 60 people were at the church service. Health officials said all of them have been asked to stay at home. The church canceled its service for this week. The presumptive positive case in Rockingham County was identified in a man who recently traveled to Italy. Health officials said that man stayed at home for several days before testing positive, and that there was low risk that he could spread the virus. We are actively conducting investigations on both individuals, but both individuals are currently isolated at home. As for their close household contacts, and they do not currently pose a risk to public health. State epidemiologist Dr. Ben Chan said at a press conference on Sunday about the 2 new cases. The Centers for Disease Control and Prevention still needs to confirm the new cases. Chan said that the new detections do not indicate wider spread community transmission. In addition to the 4 cases, about 150 people in the state are currently being monitored for any symptoms of the virus. This includes both travelers that we've been monitoring, as well as people who have been identified as close contacts to the presumptive positive cases, said Beth Daly, chief of the Bureau of Infectious Disease Control at the State Department of Health and Human Services. Chan said the state currently has the capacity to test 150 people for the virus. Officials said they're not recommending that any large public gatherings, such as this week's town meetings, be canceled. Instead, they said residents' awareness of the virus should remain heightened. For more information from DHHS on COVID-19, click here, and we have the link of this article on the Riley King Network Facebook page. And now let's take a look at this photo and graphic. COVID-19 in New Hampshire. 4 number of people in New Hampshire have tested positive for COVID-19. 107,593 number of people worldwide have tested positive. 0 number of deaths from COVID-19 in New Hampshire. 20 number of deaths from COVID-19 in the United States. 3,653 number of deaths from COVID-19 worldwide. 3 people in Grafton have it, and 1 person in Rockingham County has it. The common symptoms: fever, cough, difficult breathing. How it spreads? It's unclear how easily COVID-19 spreads. Human coronavirus commonly spreads through respiratory droplets from coughing or sneezing, though close personal contact, such as touching or shaking hands, or touching your face, eyes, or mouth after touching a surface with the virus on it. Prevention tip: wash your hands often with soap and water for at least 20 seconds. Do not touch your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. Cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash and wash your hands. Clean and disinfect objects and surfaces. Stay home from work or school if you have a fever or not feeling well. And that does it for my evening news report right here on the Riley King Network. I hope you all have a wonderful rest of your Sunday evening, and I'll see you back here tomorrow for another news report. Good night and bye, everyone.